Welcome to Medidia. This is Umar Tariq. So we're going to do another mock interview of one of Medidia mentees. Dr. Rahman is with us. Dr. Rahman, how are you doing?
I'm good, Dr. Tariq. How are you doing?
Good. Go ahead. Tell me briefly a little bit about yourself, please.
Yeah, sure. First of all, thank you so much for having me here. It's a pleasure to have the opportunity to know more about your program. So I'm Imaz. I'm currently working as a postdoctoral research fellow at Massachusetts General Hospital's Department of Neurology in Boston. And originally, I'm a medical graduate from Pakistan, class of 2021, and I'm extremely passionate about neurology. Growing up, I loved the element of human connection in medicine, in addition to the interest that I had in human biology. So these were the two things that initially drew me towards medicine. Throughout my medical school, I have been involved in some extracurricular activities like debating, cricket. I have served as a state secretary and host on a number of events and participated in some social welfare activities as well. After that, I have been in the US for over 6 months now, and I have thoroughly enjoyed living in Boston, exploring the city. I work in a lab with people from diverse backgrounds. I'm involved in clinical as well as quality improvement research. And currently, I'm preparing for my USMLE Step 3 and trying to attend some neurology conferences on the side. So yeah, that's me.
Cool. Thank you. Thank you for sharing. So you said you've been actively involved in debates, and I saw in your CV you've done a lot of declamations. So share a little bit about that experience, please.
Yeah, sure. So I was part of the King Edward Debating Society cabinet for throughout my tenure of 5 years of medical school, and I have held leadership position as well. So basically, what I did in the initial years was to get trained from my seniors, and there's this genre of debating called declamations or public speaking, where you are given a topic and you have time to prepare it. You're either speaking against it or in favor of it, and then you have to deliver a speech in front of the audience. There's a whole hall that is full of people, usually 500 to 1,000 people, and then you have to deliver your speech, and the audience are listening to your arguments, and you're scored basically on the basis of your proficiency of language, the arguments that you give, the content of your speech, and the audience response. So initial part of my debating society career was, representing my medical school, getting trained. I was able to win some laurels from my medical school as well. And then towards the later half, I took the responsibility. I had the opportunity of being in leadership positions, so I trained some juniors as well.
Okay. So I also see you worked in this organization named AMBOSS. Can you share a little bit about that? What was that about?
Yeah, sure. So basically, it starts from the final year of my medical school when I was preparing for my USMLE Step 1. I realized that, there is a very good resource out there. It was popular in, US, and it was popular in the US, but, it was not that well known in Pakistan. A lot of people in my medical school are aiming for USMLE or preparing for USMLE. So I found this resource helpful, and I contacted them, and I was fortunate to become an ambassador for AMBOSS. So basically what I did was that, it's basically a question bank, and they have a huge library where you can, look up any topic and, find answers. So I conducted some seminars with people from AMBOSS, and then there were some USMLE high achievers who used AMBOSS in their preparation. So basically through these seminars, I was trying to guide people in my medical school, and especially in Pakistan, how to use this resource wisely and to perform well on the examination. And then there is a study planner in the AMBOSS, which is built in, that helps you to strategize and plan on how to take USMLEs. So I did that, and I've been doing that for AMBOSS.
Very impressive. Also, I see that you have rotated in neuro ICU and MGH. You've been working in an epilepsy clinic in MGH and neuro recovery clinic, and you also worked in St. Anthony Hospital in Oklahoma. So, among all these rotations that you did, which one was the one you liked the most, and why was that?
I think that's a very interesting question. So I think my experiences in Oklahoma City and MGH stand out in different ways. You know, they were both the fact that the experience in Oklahoma City at St. Anthony Hospital was hands-on. So that was very good to know, get some hands-on clinical experience of how the US healthcare system works, how the EMR works here, and perform some physical examinations, take some history, enter some patient notes. So that was good in terms of the fact that it was more holistic. But I think personally, I have loved the patient care that the exceptional patient care that I saw as an observer, even at MGH throughout my clinic. This was consistent. The way the physicians are focused on patients and how they're dedicated to listening to the patients and how the care is patient focused. So this was one element that I loved about MGH. And then, of course, working in neuro ICU, I saw how a team comes together. There's a multidisciplinary approach. So I think overall, this experience has been more rewarding for me. And I think the patient-centered approach of the physicians, as well as the researchers here at MGH, has been very inspiring for me.
Cool. All right, thank you. Also, I see you published a bunch of papers, presented a bunch of papers. Among all these research projects that you worked on, which one is the one that you like the most or is most dear to your heart, and why is that?
That's a very interesting question. Actually, I have two, and I'll try to be brief. So the first one would be, it's not neurology related, but it's close to my heart because it was my first project. And it took over 2 years to publish that project. It's titled as The Perceptions of Oncology as a Career Choice Among Early Career Doctors in Pakistan. So it was my first research experience working in Dr. Abbas Khokar's lab. He's the head of oncology department. And, being my first experience, I was new to the world of research. I was learning things. I learned the basics of statistical analysis, SPSS, and I had to go through a lot of difficulties during that time, I would say. And, through that trial and error process, through, going back and forth to different people to just see which test fits best our study, so that the learning curve there was steep. And a lot of effort went into it, and it actually paid off at the end. And the fact that it was a cross-sectional study done on doctors, and it was meaningful work as well. So I would say that was memorable. And the other one would be the Association of Subacute Thyroiditis with COVID-19. It was published during the COVID-19 pandemic. And why this is special, it's because I got an email from a physician in Australia who was a patient of subacute thyroiditis. He had been having episodes of subacute thyroiditis after viral illnesses. And then all of a sudden, he got another episode of subacute thyroiditis after COVID-19. It was diagnosed on PCR. So what he said to me was that your hypothesis that there exists an association between COVID-19 and subacute thyroiditis is true, because I've experienced it. And I just wanted to let you know that I found your work, meaningful, and your hypothesis is true. So I think getting that email made my day. And, I realized the impact that research can have, and, the outreach of research. That's when that would be the reason why it's so special to me.
Very nice, very nice. Thank you for sharing that. So we have a lot of applicants, and we're interviewing only selected few ones. So what do you think sets you apart from the rest of them?
Yes, I'm pretty sure you have received applications and you're interviewing some outstanding applicants. like you do every year. But if I were to name a few things in a very humble manner, it would be that I have had the experience of working in Pakistan during my internship in neurology, and then which is a different setup as compared to US. And then I had the experience of working in some of the best hospitals, arguably MGH in the US. So seeing patient care here is another good experience that I can bring to your program. And then I have some background in research as well. So I think the kind of mixed set of experiences and well-balanced experiences that I bring can be useful to your residency program. And then on a personal level, I feel that as a person, do not have no for an answer. I try to find a way to do things, even if I do not know how to do them. So I think this is the quality that has kept me going. And, I think your residency program would find this useful for you as well.
Okay, yeah. Hoping we could be a good fit for each other. So what's your vision for future for yourself?
For future. So at this point, I think I would like to maybe 5 to 10 years from now, I would like to see myself as a clinically competent physician, neurologist who does a fair bit of research. As far as my future specialty or fellowship is concerned, I am more inclined towards vascular neurology, but I do think that I need some more clinical exposure to different subspecialties of neurology to make a well-informed decision. So I think that is a work in progress. And then most importantly, I want to see myself as a person who can inspire the younger generation. So that is where I want to go 10 years from now.
Cool. Why our program?
I think your program, because of a number of factors. The first one being that you have rigorous training. I have heard this from my mentors. Of course, the name of your program speaks for itself. And then being a person who has some background in research, I think that your program can provide me the research and fellowship opportunities to advance my career. And with some academic inclinations, I think your program offers that pathway and that mentorship as well. So I think these are the combination of factors. And then, of course, the amazing city life that you have. I think all of these factors, add up together and make your program as one of the top choices for me.
Name your one weakness.
Weakness. That's a good question. So my weakness would be that I sometimes tend to get so engrossed in my work that I sometimes neglect and ignore people that are close to me, my family, my friends. And I tend to not, I need to learn how to compartmentalize well and maintain a balance between my personal and professional life. And what I'm actively trying to, improve in my personality with regards to this weakness is that I have made a pact with myself that I will go out every weekend, either with my friends or, family. I don't have family here, but friends usually these days. So I've been doing it for the last 3 months. Every week, no matter what deadline is on the cards, I try to make sure that I at least go out with friends or do a fun activity every weekend. So that's how I'm trying to actively improve on it. And I hope that this pact, goes on for a long time.
Okay. Who's your favorite historical figure?
That's a very interesting question. Historical figure. So I think I think I have been inspired by the former Prime Minister of Pakistan, Imran Khan. I think his resilience and the charisma of his personality, and there are a lot of things that I learned from him. And I think if I were to choose one person in history, that would be, actually, I would not call it history because he is still active in the politics of Pakistan. But I think the way he played cricket, why I say when you say history, I say him because the way he played cricket at the time when he captained the side of Pakistan was inspirational. So that's why I call him, a figure that I would like to follow.
Okay, very good, very good. Do you have any questions for me, Dr. Aman?
Yeah, just a couple of questions.
Go ahead.
I, as a person who has some academic inclinations and may want to pursue an academic future, what mentorship and what opportunities do you provide for the residents who want to take this path?
So we do have some tracks. One of them is the research track, if you want to do that. The other one is a teaching track as well, in which we put you in a more leadership position for teaching junior residents, interns, and medical students. So once you come here, you can pick either one of those two paths. In the research path, you can take a few months off, few electives, and do the research projects of your choice under the mentorship of our faculty. And in the teaching track, you will be teaching students, interns, the incoming residents. So that's our teaching track, and of course, under the supervision of our mentors. So these are and I think our former graduates who have been through these two paths, they've done pretty good, and a lot of them have stayed in academic positions afterwards.
That's very encouraging to know. Thank you so much for
welcome.
answering that question.
Any other questions?
Yeah, one more question. As a person who has been heavily involved in quality improvement research, I came across your publication. I think it was an abstract, if I'm not wrong, about the efficiency of workflow in interventional radiology. So can you tell me a little more about that quality improvement project?
Yes. So basically what we were realizing, we saw a lot of problems in interventional radiology department, that a lot of cases were running late. Hospital was losing money, the department was losing money. So we did this complicated study, and I can email you the presentation of that afterwards. Basically, we just analyzed the entire process. When a patient comes, gets the procedure done, and goes back home, what happens with the patient throughout that process. And we found a lot of bottlenecks. So then once we identified 6 or 7 key issues, then we worked towards those 6 or 7 key issues. We eradicated a few roles. We added some new roles, like a board runner, whose sole job is to make sure the day goes through quickly. We started adding staggered shifts rather than everybody starting at 7 or 8 a.m. Some nurses come at 8, some come at 9 or 10. So we implemented a set of different changes. And as a result of those changes, our efficiency improved, our patient care quality, all that improved, and our revenue improved at the same time as well.
That's encouraging. That's very nice. Thank you so much for sharing.
You're welcome. You're welcome. Any other questions for me, Dr. Aman?
No, that's all from my side. Thank you so much.
Okay. Feedback time, Imaz. You did very good. Just a couple of things that there were a couple of answers, not a lot. It was very, very good interview. I'll tell you that. But there were a couple of answers that were not very crisp. Just work on those, and yeah. I'm sure with more and more practice, you'll get more comfortable, and you will learn how to be more concise, to the point, and crisp. Other than that, this was very, very good. Internet, I had 2 or 3 lags. I don't know. Are you in your office? Or you're at your house?
I'm at my house.
And this is where you will be doing your interviews?
We have to set a background. We bought
the same place, same internet, right?
Yes.
Yeah, try to have a backup internet as well, just in case if anything happens with this. Okay. All right. Other than that, it was pretty good.
Thank you.
All right. Thank you. I hope you all learned something from this mock interview. If you did, please like it, share it with others, and subscribe to the channel. And like we always say, never give up, never lose hope. Bye.